Thank you, Mr. White. Our next witness will be Mr. Tarren Bragdon. Mr. Bragdon is President and Chief Executive Officer at the Foundation for Government Accountability, which he founded in 2011 to advance free market principles. He previously served in the Maine House of Representatives from 1996 to 2000. He holds a Bachelor of Science in Computer Science from the University of Maine and Master of Science in Business from, Hudson University? Mr. Bragdon.
Chairman Johnson, Ranking Member Blumenthal, and members of the committee, thank you for this opportunity. 6 decades ago, Medicaid was created for the truly needy: children, seniors, pregnant women, and individuals with disabilities and poverty. And for 5 decades, that remained mostly true. And then the Affordable Care Act radically changed that. ObamaCare expanded Medicaid to a new class: able-bodied adults, roughly 70% of whom are childless. More than 60% self-report they don't work at all, and most are men. Today, there are more able-bodied adults, nearly 40 million, on Medicaid than any other group. For every senior on Medicaid, there are almost 5 able-bodied adults, more than 4 for every disabled person on Medicaid, and more adults than children. And even though elderly and disabled Americans are more than 3 times more expensive to cover, taxpayers spend more in total for able-bodied adults on Medicaid. In the first decade of Medicaid expansion, the program cost taxpayers more than $1 trillion, which was twice as much as originally estimated. Meanwhile, as that's happened, 700,000 Americans with intellectual and physical disabilities are stuck on Medicaid home and community waiting lists, while Obamacare's able-bodied adults are always at the front of the line. Imagine 3 people: the most physically disabled person you ever met, an impoverished elderly grandmother with severe dementia in a nursing home, and an able-bodied 20-something-year-old man who chooses not to work. Thanks to Medicaid expansion, for every dollar states spend on that 20-something-year-old man, they'll get $9 in federal match. But for that severely disabled person or that frail elderly grandmother, for every dollar a state spends, the federal government will only match about $1.30. That 90% Obamacare match perversely means that in tough times, when states have to cut back, for every dollar they cut from that 20-something-year-old man, the state will only save 10 cents. But for every dollar they cut from the elderly or disabled, the state will save 43 cents of their share of the spending. Meanwhile, Medicaid expenditures for illegal aliens have also skyrocketed through a whole variety of categories: emergency services, qualified alien, or lawfully residing status, as well as through state-funded programs like in California, or by using loopholes like reasonable opportunity periods. In fact, the number of individuals applying and receiving Medicaid coverage through a reasonable opportunity period who were unable to prove their citizenship skyrocketed 400% during the Biden administration. And what's worse is states have taken advantage of abusive money laundering schemes under the guise of so-called things like provider taxes, state-directed payments, or intergovernmental transfers to bankroll even more expenditures for expansion adults and illegal aliens. Provider taxes allow states to draw down even more federal funds with little or no skin in the game. And while state-directed payments reward politically connected providers with Medicaid reimbursement rates sometimes above commercial rates. And despite it all, rural hospitals are in shambles. Medicaid expansion has crowded countless Americans out of private coverage, and if the remaining 10 non-expansion states were to decide to expand, it would push almost 6 million more adults from private coverage onto Medicaid. So as a result, in the first 8 years of Obamacare, hospitals' profits fell by 2/3 in Medicaid expansion states, and more than 70 hospitals have closed in those expansion states since 2014. That's why the big, beautiful bill, under which Medicaid spending is still growing by 33% over the next decade, created common sense Medicaid work requirements for these able-bodied adults. It addressed the abusive provider taxes and state-directed payments, closed loopholes that allowed coverage for illegal aliens, as well as created a $50 billion rural health reinvestment fund, while cracking down on fraud, waste, and abuse. Obamacare's Medicaid expansion has left a trail of fiscal destruction. It's prioritized able-bodied adults over the truly needy, elderly, and disabled, and it rewards money laundering by states. That's costly and wrong. Thank you, and I'm happy to answer any questions.
Thank you, Mr. Bragdon.